Hi, this is a technique now that we're going to show for the lumbar spine. This is a technique that we can use for spondylolysis problem when you're wanting to restore flexion of L5-S1. And for this technique, we're going to show an indirect method of restoring flexion of L5-S1 on the right-hand side. So what you would like to do is position your patient, come forward towards me, position your patient lying down on the right side. So we have a restriction of flexion of L5-S1 on the right side, but we have an issue with hypermobility on that side, so we don't want to treat that side directly. So rather what we'd like to do is treat this side indirectly by coming on the opposite side, but biasing the right L5-S1 zygapophyseal joint into flexion. So you start off by locking down your top lever. And what we can do is we can pull the arm along the bed and towards the feet to bias the L5-S1 zygapophyseal joint into flexion. So allow yourself to roll. And we bring the lower lever, S1, into flexion as well. So now we've got the L5-S1 segment into flexion. You straighten your leg out there. So this is now biased into flexion. And what I need to do now is just roll them into me a little bit. And if I take the bottom lever and I bring it into extension on the left side, so it would be the equivalent of performing left side flexion, that will preferentially bias the right side into flexion. So this is an indirect method of flexing the right side L5-S1 Z joint. So here I can apply my grading technique. This would be a grade 3 oscillatory technique. So what you can see is that L5-S1 on the right will be opening up, moving into flexion. Okay? So you perform that 3 sets of 20, or for a couple of minutes, or until you see a change in the mobility.